Okay.
Okay.
Welcome back to Faithfully Well.
Okay.
My name is Tal Haslam, and this is...
I'm Lori Haslam.
She's a mental health professional. I'm her toughest patient, her son. And we're here. We're back. Our channel focuses on mental health and mental health within a spiritual context.
Yes.
So that's what we're doing. Today, we wanted to talk a little bit about the Lindsay Clancy case, because that's buzzing on the internet right now. There's lots of conspiracy theories about it. We'll give a brief synopsis of what went down. But we wanted to talk today less about the controversy of it and more about maybe how similar scenarios could be handled better, have been handled better, and how this is a real life mental health crisis.
Right.
Just break it down a little bit.
Right. And I think what prompted this was that we were having a family discussion because we have several family members that take medication for psychiatric diagnoses, and there were some issues within the case that were directly related to medication. So it's something that I feel everyone should talk about and know about.
So I'm just going to read a brief summary of what happened, and then we're going to go into our breakdown of it, okay? So Lindsay Clancy, who is a labor and delivery nurse living in Massachusetts. She is currently on trial. She killed her 3 children, 5, 3, and 8 months old. Super sad. Her husband, Patrick Clancy, had left the house to pick up food and medication. While he was gone, Lindsay strangled the children. She then attempted to take her own life by jumping from a second-story window. She survived but was left paralyzed. She has pleaded not guilty to murder charges on the basis that she was not criminally responsible because of severe mental illness. So what we know about her is we know that she was meeting with a bunch of different mental health professionals. She says she was dealing with postpartum psychosis.
Right.
So she obviously was a brand new mom again of an 8-month-old. And there's history of her on telehealth appointments, taking all kinds of medications. And from what we can tell, she had a pretty rocky family life. Her husband was on the way out while she was struggling. And so
it seems like she had some postpartum depression after her second child. And it is common if you've had postpartum depression to have postpartum depression again, because it's related to hormone changes. And then this time she was very distraught because she had some unrealistic expectations for herself, that she should have been a better mother. And I really don't know what went into what's really in their family dynamics. But what I do know, and what got me very interested in talking about this with all of you, is that she saw several different practitioners, and she would start taking a medication and then she would stop. And then she would go to another practitioner to try and get prescribed a medicine that she felt would have been good for her. And I think a little bit she had, as a labor and delivery nurse, she had some idea of that, hey, I'm depressed, I need meds. But unfortunately, one of the things that happens is that if you're not with one provider, it's easy to jump from provider to provider, and especially with telehealth. Now, I think telehealth is great. I spent 2 years on my mission giving telehealth counseling sessions, and when it's useful, it's just great. But in a situation where there was true evidence that she was very depressed and suicidal, I think that perhaps she should have had someone that she always saw face to face. And I think the defense brought that up, because that's one of the defenses that they have for her, that she was not seen by a practitioner in person, even when she was for sure decompensating, and she was struggling more and more. And tell that from the fact that she was talking about it, but also that she was reaching out for help to all these different professionals.
And so that was a great initial breakdown. And I want to touch on everything that you just mentioned, from telehealth versus in-person help. Also, I want to talk about how within the family dynamic, people can be supportive, because there might be some people watching this where they're not the one struggling, but they maybe have a family member struggling, a partner struggling. So let's take a little bit of a step back. I wanted to ask you some questions that I want clarification on. So could you help us understand the difference between normal mental health challenges and psychosis? There are people who have postpartum depression, right? And then there are people who experience postpartum psychosis. So could you talk about what the difference between those is?
Well, Psychosis, the definition of a psychosis is that you have a break with reality, meaning you hear voices that you assume are talking to you and they're not really there. So those are called auditory hallucinations. You may also have visual hallucinations. You may see things that are not there. And those voices usually are very negative. It seems like in her case, they were telling her that if she didn't do something, then her children wouldn't survive. And so with psychosis, that it's not, you've definitely lost contact with what's going on around you. So that is easy usually to diagnose. However, on telehealth, you could just not say anything about hearing voices or seeing things.
Because having been in different psychiatrists' office, they are relying on what you're telling them.
Right.
And so that's the really difficult part, because you can go in there and you could say anything. And they're trained professionals, so it's not like they're just going to do what you tell them to do all the time.
Right.
But at the same time, it is very subjective. So
yes, and we do have to rely on the self-reporting that each client or patient gives to us. Usually with a psychosis, if you spend a certain amount of time with someone, you can see that they're looking and paying attention to something that is a hallucination, or they'll just begin talking about the voices that they're hearing. And go ahead.
The question that I had too is with postpartum psychosis specifically.
Oh, yeah.
So she's obviously on her third child.
Right.
If postpartum depression goes untreated, does it get worse as time goes on?
Not necessarily.
Okay.
Just harder to get through.
Okay.
So postpartum depression can be something that you experience for a period of time and then it dissipates over time. Most what we call mood disorders, which depression of any kind comes under that heading, they have lives where they cycle in and out. And the trigger, if you want to say, would be all the hormonal changes that go along with pregnancy and birth. Now, if you have a supportive system around you, because anytime you have a baby, it puts a lot of stress on the family. And a third child can put a lot of stress on a family. And if you don't have resources, say grandma and grandpa or a community, then you're more likely to be apt to have a very difficult time, or you feel maybe you're not hearing voices, but you're so depressed that clinically you just can't help yourself up out of it. You can't get out of bed. You're constantly thinking about killing yourself. Notice that the psychiatrist said on the stand, that the psychiatrist that was doing the telehealth appointments, which were the few last appointments that she had before she killed the children, she asked her questions about suicide, and she said on the stand, but she didn't have a plan. Well, that's what we look for as the marker for, yes, this person knows what they're going to do, they've planned it out, they're very suicidal then, and we want them to then get into probably inpatient treatment until we can get them on the right meds and help them out of that suicidality. But on telehealth, again, I just think it's easy to look like you've got it all together and you're doing okay. And of course, don't know what went on in the sessions or anything, but the psychiatrist did say, well, she didn't have a plan, so it felt like we could take the risk of giving her a different medication and then sending her on her way, basically.
Got it. One thing that you mentioned was a support system.
Yes.
I think something that popped into my mind was that I wish I knew when I was younger is that isolation is the worst thing you can do when it comes to mental health. Obviously, just in general, everyone needs friends, everyone needs family around them. But sometimes, speaking from personal experience, I've had times where my mental health wasn't great, so I wasn't necessarily performing well in school or at work or whatever. And then I felt a lot of shame about that. And then I saw people less and less. And that's natural. But at the same time, all I was left with then is you're isolated, and all you have is your mind and the stories that you're telling yourself about what's going on.
Right.
Which tend to be the worst.
The worst / not even in touch with reality. Right. And we call that rumination, when you've got a thought that you can't get rid of, or an intrusive thought, something that you can't get rid of. And there may be voices in your head saying things like, kill yourself, you need to die, or you're Satan. It's interesting because as far as religion, there's a lot of grandiosity in a psychosis around religion. I met someone in the Navy hospital who thought he was Jesus Christ, and then he jumped out a window and he had severe injuries and then was hospitalized at the Naval Hospital. But so you can think, well, this voice is the truth and I need to do what it says or else. One of the hallmarks of a severe depression is this feeling of worthlessness and this feeling that I am a loser, I don't matter to anyone, shouldn't be here. There's lots of, why did I do that? There's just this over and over rumination. And the more you tell yourself that you're no good, you start to believe it more. It's a vicious cycle of if you're in your room and you're thinking about it and I'm such a loser, didn't go to class, my parents are gonna be upset with me, and then you experience a lot of shame because you feel like you're not living up to expectations you have of yourself or family has of you. And shame is, I like to say, it's a very sticky emotion. It stays in your brain, and shame and blame are hard to get rid of once they're there. And our brains are wired so that everything we think and everything we do changes them. So if you have a stream of negativity, or if you're listening to voices for several months that are telling you need to kill yourself or kill your children, it's very hard to discern the difference between real thoughts and the voices in your head.
And so it's good to just have people that you can check in with, people that can keep you in check, or especially if you're starting a new medication.
Yes.
It's really important from personal experience, like every medication, I'm very pro medication, I think it's awesome, but it has side effects. Some of them don't always work. It takes a while for them to work. If you quit them abruptly, it can have negative side effects. And so you need to have someone who can be there and check in on you. Ideally, that would be a mental health professional that you could be sitting down with a lot, but if a lot of times people don't have that. It's important to have a family member who's not judging you for taking medicine or trying to get help, but is just there to be a tether to reality while you're struggling.
Right. So a depression, a mood disorder, it affects your behavior. And so you hope that the person that is living with you will see a change, an improvement, like that, oh, all of a sudden she's able to get out of bed, or she's able to cope better with no sleep or of a newborn, and just all these things. But each medicine, psychiatric illness, it works in different ways, and the chemistry of them are different. They can work against each other. You can have, for example, terrible reaction, an opposite reaction than what the medication is supposed to do. If you have early bipolar illness and you're given a certain class of drugs called SSRIs, that can throw you into a manic episode. And almost all providers of psychiatric or mental health care know those things, but it really makes a difference if you have someone at home or in your community of friends that will check on you, will ask you questions. That there's such a stigma.
And so the stigma thing brings me to my next question for you, which is something I've thought about myself, but also I think a lot of people are wondering. So obviously mental health issues, they don't happen in a vacuum.
Right.
And in the Lindsay Clancy situation, again, we're not here to put the husband or her on trial or whatever. We're not making judgment calls, but it's pretty obvious that she didn't have as much support as maybe she needed. And so my question is, at what point do you look at the relationships around you as causal to your mental health issues and something that needs to be addressed versus just like, hey, I'm struggling personally and I need to work on this?
So the first order of business is working on crisis mode and making sure that your own mental health is taken care of, because sometimes it's just the mental illness that's putting a lot of stress on the relationship. Then when you're in a more calm mental state, then you can maybe start to talk about some of the issues that are going on at home. The one thing that I think is important for people to know, especially new mothers, is that almost every hospital they can refer you to a clinic where you can go to groups for moms that are struggling with postpartum depression. And you can see that, oh, my symptoms, I'm not crazy, this is what's happening. And yeah, you can talk about reactions to medications, side effects, because you have a professional there to guide you through that. I would say that it's important for families to learn all they can about a diagnosis. I don't really know what the situation was, but I'm guessing that sometimes if you have a long-term mental illness or if you've had episodes of postpartum depression, it can get very discouraging for the spouse. They don't know what to do.
So that's my next question then is, say you have a partner or a sibling or an extended family member that's struggling.
There are organizations. There's an organization called NAMI, the National Association of Mental Illness Help, that family members can go to. There are hotlines, but it's hard to know those things if you aren't really savvy at hooking yourself into all the resources. And sometimes because of stigma or because of just, I'm trying to take care of 3 kids, I'm trying to feel better, you isolate and you just don't reach out. So it's important to have a point person that can help you with that. And if you're a sibling or a parent, parents struggle through, you have to remember that there may be some psychosocial dynamics that happened in the family early on that contributed to this mental illness, but mental illness itself is biologically based. And so there's changes in your brain. Those need to be addressed. Family members often feel very guilty because they feel like, well, I don't know what to do. What can I do? This must be my fault. And so that's where counseling helps. So I would always recommend counseling for the whole family. If there's someone that especially has a psychotic break.
Okay.
So,
and a lot of the through line that I heard in your answers there, obviously you articulated it way better than I could, but seeking professional help and professional guidance, which sounds so obvious, but luckily I didn't experience that within our family because you're so knowledgeable and you have your own experience, and I went to doctors and stuff. But even that, in my immediate community, there are people who you don't need to take medicine and keep in mind, these are not doctors or people who know what the heck they're talking about. They're just people. I get that people have opinions, but at the same time, you would not go, if you
diabetes, chronic illness.
If you had diabetes, you wouldn't call up your buddy who's an auto mechanic and say, hey, what do you think I should do for my diabetes? They would not be, they would probably say, go see a doctor, because that's a very normalized condition.
Right. And we say, oh, diabetes. Okay, medication.
But the problem with mental illness, stigma, is that a lot of times people will just say, well, you need to just exercise or you need to pray more. There's a lot of, and not to mention everyone watching this is scrolling through TikTok and there's like a bajillion different opinions out there. And it makes me really sad when I hear people who have stopped trying to treat their mental health or stopped trying to improve their mental health with professionals because someone close to them is making them feel bad about it.
Right.
So.
I often heard when I was talking to missionaries in the mission field, I would hear, well, if you just had enough faith, you would feel better. And for women just in general with postpartum depression, it's, well, you have a baby. It's something you were looking forward to. You really wanted. And how can you feel bad and feel unhappy if you've got something that you really wanted? And then there's the shame that comes in with, I'm not able to handle this. And the shame, again, makes all those negative feelings much stickier and they stay in your brain. And then you're more apt to look at life through a negative filter, which is what happens. And moms can be isolated just by nature of, say, you're a stay-at-home mom. And if you don't have a support system, and things that helped me were going to little tiny toddler groups in the community, asking my friends to come over. I had to be very proactive because not that I got depressed, but I had a husband who was always traveling. And so he wasn't there and I had to help myself. But I also had to remember to take my medication, and I had to remember that if I don't put too much on your plate, and I had to do a lot of talk about this is an unrealistic unrealistic expectation. You need to just focus on what's the most important. And sometimes I have a lot of training, so I knew, but a lot of people, they don't have these tools because it's like, oh, I'm married, I had this baby, I should be so happy, what's happening to me? And they don't understand the voices that are going in your head.
And even for a perfectly healthy mom, I call it the mom guilt industrial complex,
right,
because there's so many different, this is how you should do it, this is how you should feel. And there's so much pressure put on moms to be perfect and
yes,
not have any negative emotion, which is
yes,
which is freaking nuts,
right,
honestly, because it's such a big life change.
It is nuts, but it's interesting because, for example, within a culture, we find how you should do things, right? And so TikTok and social media, especially now, you should feed your child this way. You should make sure that you should breastfeed versus bottle feed, or why would you breastfeed when you can bottle feed? There's things like sleep training and not sleep training. And then if you have a baby that's crying, that's got colic or something like that, all those things people have opinions about. And so it's hard not to listen to those voices and then to begin saying to yourself, there's something wrong with me, I'm not coping. But again, it's these societal expectations. And in other cultures, like in China, 6 weeks you don't go out of the house because you're taking care of yourself and your baby and you're recovering from childbirth. Whereas especially I've seen this in the church, some women are like, okay, I had my baby on Tuesday and on Sunday I'm in sacrament meeting. Look at me. Look at how great I am. And I think your baby's getting exposed to germs and your poor body it probably needs some rest. And so we can have unrealistic expectations from the community we live in, the society we live in, and then just ourselves, if we tend to be really hard on ourselves and perfectionistic.
And so I think just as a general rule, take advice from professionals who have
yes,
gone to school, have a license, and can give you advice that is professional advice.
Yes.
And it's okay I think it's better than okay to, like you were saying, talk with other moms, talk with friends. It's super important to I'm a dad, I have different friends that have different opinions on fathering. It's not like I'm not going to hang out with those people.
Right.
But at the same time, I'm not going to go to a friend and be like, do you think I should vaccinate my kid? I'm going to go to a doctor and talk to him about that.
Right.
So, okay, I'm going to pause it and start again. So I wanted to talk the best approach to taking psychiatric medication. We're not psychiatrists, so we're not giving prescriptive advice about this, but at the same time, I think a lot of people don't know what to expect, or they're maybe freaked out. I'm going to take this and on day one, I'm going to be sedated and have a different personality. There's a lot of boogeyman stigma around medicine.
Right. Yes.
And so I wanted to talk about that a little bit.
Well, first of all, with any psychiatric or psychotropic medication, it takes, like you mentioned this, it takes a while to get it what we would call full efficacy at the best dose. And there is a lot of trial and error in that, usually because they can have side effects. And the side effects are things like dry mouth and nausea and diarrhea. They're not, you're going to turn me into a monster that's going to go raging everywhere.
Right.
That would be related to more exacerbation of a mental illness. So you have to give it time. You have to work with the doctor, who may start with a lower dose and raise the dosage till he gets to the dose that's going to help the most. Doctors know that. And there's been so much research. For example, if someone has OCD, they need a higher amount of medication than someone who's maybe having anxiety and depression.
And I have an anecdotal story about that. So I grew up, when I was a freshman in college, I started taking SSRIs. And when I developed, or I don't know when I developed OCD exactly, but when I started really struggling and I went in, I was very resistant I wasn't resistant to taking SSRIs, but I was very resistant to taking whatever the class of medication where it's a fast-acting anti-anxiety. Xanax.
Oh yes, Ativan.
Some of those are like benzodiazepines.
They're a whole class. They're all benzodiazepines, and they work quickly. And if you're having a panic attack, taking a Xanax is a good thing, but they're habit forming.
Right.
And so you can become dependent upon them, and then you may need more and more for the same effect. So that's one of the reasons that you need to be followed by a clinician, so that you can use Ativan if you need it. If you're in the midst of a panic disorder that you can't get yourself out of, those fast-acting benzodiazepines are great, and they might even be coupled with a slow-acting antidepressant.
And I wanted to share my personal experience because for, I want to say 2 or 3 years, was telling psychiatrists no. I do not want to take a fast-acting anti-anxiety medicine because it really scared me. I was really scared of the
I
habit.
probably scared you. That it was habit forming.
We have addiction issues in our family history.
Right.
I have a very obsessive personality, clearly, because I have OCD. Well, I just didn't want to be hooked on something. I just was worried about that. And so, but I started taking, they gave me a Xanax prescription, which...
Is this in New York?
This was in Utah.
Oh, Utah. Okay, Utah.
So I finally had a psychiatrist who was like, hey man, you are seriously struggling. You can't sleep. Like, you are not functioning as a normal member of society, which is hard to hear, but he was like, you need to try these, which I really appreciate, because I finally was like, all right, I will try these. What ended up working for me really well, which I don't take anymore, but was gabapentin. Again, this is not prescriptive advice, so
No.
go to a doctor, but I'm just telling my personal story. And that was the first time I was able to really make progress in terms of breaking cycles of obsessive behavior. So it's ironic because it actually had the opposite effect. I had this pattern, which wasn't a drug addiction, it was an obsessive compulsive thing, but I was afraid of forming a habit. And so I was holding on to a really destructive lifestyle. And then when I finally took this medicine, like the doctor was telling me to, which multiple doctors had asked, I really was able to make progress. And I was able to sleep when I was trying not to act out on a...
How would you describe a self-destructive lifestyle?
Self-destructive in terms of I wasn't functioning. So I was not progressing in life. I was failing classes. I couldn't get out of bed. I would have nights where I couldn't sleep, a few nights where I couldn't sleep. And so when I say self-destructive, I wasn't my normal happy self. And so when I started taking those medications, it wasn't like all of a sudden I was addicted to Xanax and I was loopy all the time. It just lowered my physiological response to all this anxiety I was experiencing, which allowed me to implement better habits.
Yes.
And so I feel bad for my younger self. I wish I could go back and say, hey, you should take these slightly more intense medicines because it's going to help you. You really need that. And so I share that because I think there are a lot of people out there who are struggling more than they realize. Because when it's just your reality, people downplay that a lot. And of course, there are those who exaggerate their reality and maybe would be okay if they pulled themselves up by their bootstraps. But a lot of times people are suffering internally a lot more than they let on.
Absolutely.
And you need help.
It's very painful. It's hard to physically describe, but when you're in your head like that, your nervous system completely changes. You're on alert all the time. You're scanning for danger. You're looking for someone to tell you that you're right when you're not. And it's just very painful. And it's very confusing. And when something's working within our brains, if it's a biological change, you can't just pick yourself up by your bootstraps. You need to have an intervention, and the intervention needs to be the same way you would if you had pneumonia. You have garden variety anxiety that hit on a regular basis, but all of a sudden you're put into a very stressful situation, like college, like a mission, like having a new baby. They're just all life things, but if you have a predisposition, you've had some anxiety, you may then go into a full-blown panic attack and be afraid of things. A panic attack, you can hyperventilate. You definitely cannot function because sometimes you're so afraid of everything. Feels like, oh, I'm having a heart attack, I'm going to die. And unless you get professional help, it's going to get worse. Your behaviors are going to get worse, because if you're afraid of leaving and you don't leave, then you're safe. But in order to function in life, you need to leave your apartment. You need to go to class. So those are the things that we always look for how are you functioning? And rate your day. Are you all your days at 10s or all your days at 1s? And anyway, it's just very painful. And that's where I feel, same thing, I feel badly. I feel badly as a mom thinking that you went through that.
Well,
But
I was just figuring it out.
right. And the other thing that you did that was good is you didn't throw in the towel. You kept searching and until you finally found gabapentin, and which calmed your nervous system down.
Right. I think to bring it back to the Lindsay Clancy thing, I don't know what people are saying totally online. I've read some stuff, but she was going to a bunch of different doctors and taking medications, and it sounds like it was a pretty like hodgepodge, not professional scenario. Who knows why that happened? I don't know if that was her. Who knows? But I just want to get the point across that if you go to a mental health professional and you get prescribed medication and you take it as directed, and then you have a support system around you, it can be super helpful.
Right.
And it's not this big scary boogeyman where it's like
No.
derail your life. It will have the opposite effect. If you eat it, it'll have the opposite effect.
Right. Medication is just so wonderful. And from the time that I was in school, there were antidepressants that still work very well but have heavy side effects like heavy sedation, constipation, and your whole system slows down. Whereas now the side effects are very few in number, and usually the longer you take a medication, you don't even notice the side effects dissipate. You don't even notice. You just know that you're functioning well.
Right. And I don't want to get too controversial, but it's like if mental health was something that we saw on our exterior more, if it was like weight loss, everyone and their dog is on a GLP-1 now, which who cares, do what you want, but don't tell people not to take medicine when you're willing to just hop on whatever cocktail to look jacked.
Right. Well, and so, I guess I didn't finish my analogy, but like if you had a cold and then it went to pneumonia, you would get antibiotics, or else you're probably it'll worsen and you'll have sepsis and you'll die. Same with if you have some anxiety, very stressful situations, and you need to address it before it blows up and you're suicidal, and your vision is that the only way to feel better, to get out of this pain, is to kill myself. Or in her, Lindsay Clancy's case, to kill my children, and because her brain wasn't functioning right.
And that's another question that I had, because it's one thing to talk about depression and OCD and stuff not that those aren't difficult to talk about, but I think we've made as a society, we've made a lot of progress as far as the stigma and talking about stuff that. Being said, maybe I'm wrong, but it's pretty rare to have someone pick up their phone and make a TikTok about how they want to kill themselves, right? Or how they're having suicidal ideation, or they want to kill their kids. That territory, there's a lot of shame and a lot of stigma around that. And so I wanted to ask you, how do you think we could be better in families, in church, at school, talking about those things? Because I've had suicidal ideation for sure. And I just, how do you talk about those things in a healthy way?
Well, you have to get comfortable. You have to practice. You have to be willing to open yourself up and be vulnerable. And within a family, the more you can be honest and about how you're feeling, then it helps the other family members around you. And it may lessen their guilt. They may feel like they're doing something wrong. And there really is no good answer other than the more we do it, we'll get more used to it. We'll recognize, okay, something's going on here with you. We need to intervene and get you to the doctor because you're having suicidal thoughts. So usually people don't tell others that they're suicidal. And so that's where a professional a lot of times can draw that out of them and get them to recognize sometimes the feelings of worthlessness people don't associate with suicidality. They just think, oh, I'm a worthless human, shouldn't be here. And they don't recognize that that's suicidal thoughts.
Because there's just so many scenarios, and I've talked to people, or people, if they've lost a loved one to suicide, or they of course say now, I wish they would have come to me, or I wish we would have talked about it. But at the same time, and I'm not trying to blame those people specifically, because sometimes it just happens. People struggle and have a hard time. But at the same time, I spend a lot of time thinking about having a young family. How do you cultivate an environment where it doesn't just come out of left field? You're not just like, how did this happen? Because that's usually, it seems like someone does something to blow up their life, whether it's harm or like an affair or drug use or something crazy, alcohol use, crazy, which is probably not a good way to talk about it, but something dramatic.
Right.
And I spend a lot of time thinking about, well, how do you clue into what people are going through before it explodes?
Well, one thing you always need to remember as a family member, that Sometimes you can do everything the right way. There is no right way. You can do everything, and that person is suffering so much that they either turn to some substance abuse or they turn to some self-harm. So you got to remember that. It is sometimes no matter what you do. But the faster you intervene, that's the key. The faster you intervene, there was a statistic that I loved and that we learned in the mission is that as a missionary, you're watched. You're under the microscope. So your companion's watching you, your district leader's watching you, your zone leader and your mission leader. And so when your behavior starts to change, you're usually diagnosed with a psychosis within 3 days or so, maybe 2 days. And the average person does not get diagnosed with the correct psychiatric diagnosis until 19 months later, sometimes years later, because they don't get the right help. So missionaries, there's a lot of support there. So that's what you do in a family, and you just talk about it matter-of-factly, the same as talking about physical illness. Oh, you have a cold, so you need to get some sleep, drink more fluids. Oh, you're struggling with intrusive thoughts that are really giving you a lot of pain. Let's go figure that out. Let's go talk about it. Talk to me, tell me. And that's why family therapy is so good. It can only be, sometimes it's just one session where you get taught about, oh, well, that's why this is happening. Or, oh, this is something that we know more about now, so we can talk about. And it just takes practice, everything.
And so it's good to practice talking about how you're doing, practice reaching out for help. The world that we've built around ourselves is not conducive to mental wellness, unfortunately. And there's a lot of data on that with social media and
the pace of life,
working from home. There's a lot of things that, again, it's just the way that it is. And I don't think they're going to change. I think they're going to keep accelerating. But where I would like to see things go, and I'm just spitballing, but the fast food industry, when did fast food get huge? Like 80s?
Probably 80s.
Now there's a lot of information, like nutrition information about the fact that there's a lot of junk in the stuff that we eat.
Right.
And people are aware of that. And I think that I would like to see a world where we're more aware of the junk in our lifestyle so that we can talk about it and treat it. Obviously, these multi-billion-dollar corporations like Meta and whatever, they're not going away. They're continually becoming more and more of a part of our lives. And I don't even think that's necessarily a bad thing, but I do think that with that, you need to talk about the fact that, hey, it's not really biologically normal to stare at a screen for 10 hours and feel normal.
Feel good about anything.
But you wouldn't think that though, because it's like, hey, I need you on all these Zoom calls today.
Right.
And you need to respond to every text within 30 minutes. You need to have the amount of social media followers. That's more the message we're getting.
Right.
And I feel so sad for a mom like Lindsay Clancy, who knows what information she was getting about what she's going through.
I would agree. And that's why we're doing this. We're opening up. And
we are the solution to your problems.
We're not. But again, my life goal is to just, if I could lessen the stigma just even a little bit. And especially for members of the church. This is something that is a difficult part of our generation, the time on the earth. But it doesn't take away from the fact that we have Christ, our Savior, our Redeemer, the Holy Ghost that can guide us. But these are real problems. And the more we address them, we'll be able to have more success. More people will feel better.
Awesome.